Imagine you're sitting in your living room, flipping through the mail, and there it is, a glossy brochure promising free gym memberships, dental checkups, and even meal deliveries, all wrapped up in a Medicare Advantage plan that sounds too good to be true. But what if I told you that behind those shiny perks, thousands of seniors are getting slammed with denied treatments, surprise bills, and locked into plans they can't escape? Stick around, because today I'm pulling back the curtain on the 5 shocking downsides of Medicare Advantage plans that insurance agents won't whisper a word about. These aren't just theories, they're real pitfalls that could derail your retirement health and finances. By the end, you'll know exactly what to watch out for and how to protect yourself. Let's start with the basics, but I'll keep it real and straightforward. Medicare Advantage plans, also known as Part C, are private insurance alternatives to original Medicare. They're run by companies like United Healthcare or Humana, and they've exploded in popularity. Over half of all Medicare folks are enrolled now, drawn in by those $0 premiums and extras like vision, hearing aids, and yes, those gym passes. On paper, it seems like a no-brainer. The government pays these companies a fixed amount per person, and they handle your coverage, often throwing in bonuses to sweeten the deal. But here's the hook. Those free perks come at a hidden cost. While original Medicare lets you see almost any doctor nationwide without jumping through hoops, Advantage plans play by different rules. And trust me, those rules can bite hard when you least expect it. Picture this. You're a retiree named John who's been seeing the same cardiologist for years. You've built trust, he knows your history inside out. Then, you switch to a Medicare Advantage plan because the ad promised lower costs and free dental. A few months later, chest pains hit, and you rush to your doc, only to find out he's not in-network. Boom, you're stuck. This isn't some rare horror story. It's the first big downside, network restrictions that cage you in. These plans force you into a limited pool of doctors, hospitals, and specialists. If you go outside that network, you either pay through the nose or get flat-out denied. According to reports from places like the National Council on Aging, many plans have super narrow networks, especially in rural areas where options are already slim. Imagine living in a small town, and the nearest in-network hospital is an hour away. What if it's an emergency? Sure, emergencies are supposed to be covered anywhere, but good luck proving it was urgent enough after the fact. I've heard stories of folks like Sarah, a 72-year-old widow who needed knee surgery. Her plan's network didn't include her trusted orthopedic guy, so she had to settle for a stranger 2 counties over. Delays piled up, pain worsened, and she ended up regretting the switch. And get this, per Medicare.gov's own Plan Finder tool, you have to check these networks yearly because they change without much warning. Why do insurers do this? To control costs and keep profits high, of course. But for you, it means less freedom, more hassle, and potentially worse care. Before signing up, always use Medicare's online comparator to map out the network. Ask yourself, can I really live with these chains? But wait, it gets worse. Even if you stay in network, getting the green light for treatment can feel like begging for scraps. That's the second shocker, treatment denials and those dreaded prior authorizations. These plans require insurance approval before many procedures, tests, or even meds. Sounds reasonable? Think again. Denials are skyrocketing, and they're not always fair. Take Maria, a lively grandma battling cancer. She needed an MRI to check if the tumor had spread, but her Advantage plan demanded prior auth. Days turned into weeks waiting for approval, all while her anxiety spiked and the disease potentially progressed. Finally, denied, because the insurer claimed it wasn't medically necessary yet. This isn't fiction. A 2022 report from the Office of Inspector General found that 13% of prior auth denials in Advantage plans violated Medicare's own rules. We're talking about essential stuff like imaging scans or post-hospital rehab. In 2023 alone, insurers denied over 3 million requests per KFF data. Why? To save money, plain and simple. They use algorithms and reviewers who might not even specialize in your condition to second-guess your doctor. The fallout? Delays that harm health. Studies show higher denial rates lead to worse outcomes, especially for chronic illnesses. One NBC News piece highlighted rural hospitals struggling because Advantage plans reject claims left and right, citing human error or system glitches. But really, it's profit-driven gatekeeping. And in end-of-life care, heartbreaking. Families report denials for hospice or pain management, forcing tough choices. If you're hit with a denial, appeal fast. Medicare.gov outlines the process, and you can win about half the time. But who wants that stress when you're already sick? It's a system rigged to frustrate, and it preys on the vulnerable. Now let's talk money, because those low premiums are a siren song hiding a financial trap. The third downside, high out-of-pocket costs and sneaky hidden fees that can bankrupt you. Yeah, those ads scream zero premium, but they conveniently skip the part where you're on the hook for thousands in copays, deductibles, and surprise bills. Picture yourself fresh out of the hospital after a hip replacement, excited to get back to gardening, only to get slammed with a $5,000 bill because your rehab facility wasn't preferred enough. This is the reality for too many seniors. And it's the third shocker. Medicare Advantage plans can bleed you dry with unpredictable expenses. Here's how it works, or rather, how it screws you. Original Medicare has no out-of-pocket maximum, but you can buy a Medigap policy to cap costs. Advantage plans? They promise an annual cap. Sounds great, right? Wrong. That cap can be as high as $8,850 in 2024 per Medicare.gov, and that's just the max before coverage stops. But get this, many plans layer on copays of $40 to $100 per doctor visit, 300 plusors for ER trips, and 20-50% co-insurance for outpatient stuff. Add in narrow networks, and one slip-up outside them means full price, thousands per visit. A Kaiser Family Foundation analysis found that 15% of enrollees hit their out-of-pocket max annually, often from chronic conditions like diabetes or heart disease. Let me paint the picture with Tom, a 68-year-old veteran on a fixed pension. He picked an Advantage plan for the free Silver Sneakers gym perk. Then arthritis flares up. Specialist visits, injections, PT sessions. Copays stack up to $4,200 in 3 months. He rationed meds to save cash. Pain got worse. Landed back in the ER. Boom, another $1,500. By year's end, he'd spent more than his entire Social Security bump. Stories like his flood Medicare complaint lines. Over 1,600 billing disputes monthly, many from Advantage users shocked by the fine print. Why the trap? Insurers pocket the government's flat fee, about $13,000 per enrollee yearly, and squeeze costs onto you to boost profits. In 2023, these companies raked in $400 billion, with executives cashing million-dollar bonuses while you foot the real bill. And it's not just routine care. Complex stuff like cancer treatment? Prepare for a nightmare. One enrollee I read about faced $12,000 in uncovered chemo drugs because they weren't on the plan's formulary. Medicare.gov warns, always check your plan's evidence of coverage document. It's 200+ pages of jargon detailing these bombs. Use their cost estimator tool before procedures. Ask, is this free plan really free or a ticking debt bomb for my golden years? But here's where it really stings. You might think, fine, I'll just switch back to original Medicare. Dream on. That's the fourth brutal downside, getting stuck in these plans with no easy exit. Once you're in Medicare Advantage, reversing course can leave you high and dry, especially if health issues pop up. See, original Medicare pairs perfectly with Medigap policies, private supplements that cover gaps like deductibles. But insurers can deny you Medigap or jack up rates if you try switching after your guaranteed issue window slams shut. That window? Only your first year on Medicare or during the annual enrollment period if you're healthy-ish. Join Advantage, get sick, then bail. You're in guaranteed issue hell. Carriers see your claims history and say, pre-existing conditions? No thanks, or pay triple. Meet Linda, 75, who jumped into Advantage for dental perks. 2 years in, network shrunk, denials mounted. She wanted out for original plus Medigap. Denied. Her breast cancer history scared off every insurer. Now she's trapped, paying higher copays yearly while her plan changes rules. Medicare.gov confirms, post 65, only specific events trigger new rights, like moving out of state. A 2023 survey by Justice in Aging found 20% of switchers faced coverage gaps, forcing some back into bad plans. The conflict? You chase shiny extras, only to lose choice forever. Insurers love this lock-in. It keeps their enrollment numbers fat for more government cash. Before leaping, ask, What if I need to escape in 5 years? Map your de-enrollment guarantee now. You're probably thinking, okay, but plans don't change that much, right? Wrong again. The fifth shocker, total instability. These aren't set-it-and-forget-it deals. They're shapeshifters that can vanish, hike costs, or gut benefits overnight, leaving you scrambling every fall. Every October, during open enrollment, thousands discover their plans gone poof, exited the market, or shrunk networks. In 2024, over 120 plans disappeared, per CMS data, stranding 1.2 million enrollees. Benefits? Slashed. That free gym? Now $50 a month. Dental cut from $2,000 to $1,000 cap. Premiums jumped 20% in some areas. Why? Insurers chase profits, dropping unprofitable regions or tweaking to dodge sick patients, a practice called cherry-picking. Medicare.gov's Plan Finder shows year-to-year chaos. What's covered today might cost you tomorrow. Imagine retiree couple Bill and Ellen, cozy in Florida. Their Humana plan offered vision and meals. Next year, network cut 40%, meals gone, copays doubled. They fought appeals, wasted weeks shopping new plans, stressed city at 70+. A ProPublica investigation revealed insurers warn enrollees late, burying changes in fine print. Result? Forced switches to worse options, care disruptions, even skipped meds. Rural folks get hit hardest. Networks evaporate, hospitals close. The drama? You retire thinking you're set, but annually face a high-stakes poker game with your health. So let's step back and think this through. Medicare Advantage isn't all evil. Low premiums and perks help millions, especially healthy folks. But for the 40% with chronic conditions, it's Russian roulette. Data from Yale shows Advantage patients get 20% fewer cancer screenings, face longer hospital stays, and higher mortality in some cases. Why? Gatekeeping prioritizes bucks over lives. Contrast that with original Medicare, Dr. Freedom, nationwide acceptance, predictable Medigap costs, though pricier up front. The real mindbender, government pays Advantage plans 4% more per person than original, yet they skimp on care to profit. Over $12 billion in overpayments yearly, per HHS audits, funding those TV ads and exec jets. You're not just buying insurance, you're funding a profit machine that rations your treatment. Weighing it all, is Medicare Advantage worth the gamble? For some, healthy seniors who stick close to home and rarely need big care, yeah, those perks like gym access or over-the-counter allowances can feel like a win. But dig deeper, and the scales tip hard against it for many. Recent 2025 data from the Kaiser Family Foundation paints a stark picture. Over 60% of Medicare folks are now in Advantage plans, lured by aggressive marketing, but complaints are surging. Denials hit 3.2 million in the latest tallied year, with 6.4% of requests shot down, often for stuff doctors deem essential. And those out-of-pocket caps? They sound protective at up to $9,350 for in-network care this year. But that's still a massive hit for someone on Social Security, especially when plans pile on extras like 20% coinsurance for chemo or hospital stays. The inner conflict here is brutal. You sign up thinking you're savvy, saving bucks up front, only to realize you're trading freedom for chains. What if a specialist you need ghosts the network? What if a denial delays surgery and your condition worsens? These aren't hypotheticals. They're the stories flooding forums and Medicare hotlines. Yale studies echo this, showing Advantage enrollees sometimes skip preventive care due to hassles, leading to higher costs down the line. Contrast that with original Medicare. Sure, premiums for Part B are about $174 monthly in 2025, and you might add $200, $300 for a Medigap policy, but you get nationwide doctor choice, no prior auth mazes, and true peace of mind. No wondering if your plan will bail on you come January. And the hidden threat? That profit machine keeps churning. In 2025 alone, the government shells out 20% more per Advantage enrollee than original, translating to an extra $84 billion taxpayer dollars funneled to insurers per KFF analysis. HHS audits spotlight overpayments fueling this, with plans like United Healthcare and Humana banking billions while auditing every claim you submit. It's a system where your health data becomes their goldmine, used to justify higher bids from Uncle Sam. Ever feel like you're the product, not the patient? That's the vibe. So, what's the play? First, if you're eyeing Advantage, grill it hard. Hit Medicare.gov's Plan Finder tool. Plug in your zip, meds, and doctors. Check the star ratings. Low ones scream red flags like high denial rates. Talk to a SHIP counselor. Free, unbiased advice from state pros. If you've got chronic stuff like arthritis or heart issues, lean Original plus Medigap. Yeah, it costs more monthly, but caps your risk forever. And if you're already in Advantage and smelling trouble, use Open Enrollment, October 15th to December 7th to switch. But plan ahead. Don't wait till a crisis hits. Bottom line, don't let glossy ads blind you. Knowledge is your shield against these traps. If this hit home, smash that like button. It helps spread the word to folks who need it. Drop a comment. Have you battled an Advantage denial or switched back? Share your story. It could save someone else's retirement. And if you're not subscribed, hit that button now. More eye-openers on health hacks, retirement pitfalls, and beating the system coming your way. Share this video with a senior in your life. They might thank you later. Stay sharp out there. Your health's too precious for surprises.